Have you ever found yourself grappling with emotions that seem to take on a life of their own? Or torn between gratitude and fear, not knowing which to feel? Well, you're not alone. Hi, and welcome to Kidney Cancer Unfiltered, the podcast by the Kidney Cancer Association, diving deep into the raw stories of kidney cancer patients and survivors. I'm Anna Maria Scaccia, your guide through the real, unfiltered experiences that often go untold. Today, we are joined by expert Lauren Burling with the Cancer Support Community. Burling, a therapist and clinical oncology social worker, unpacks the heavy emotions people with cancer often feel through their journey. Together, we'll discuss the evolving landscape of psychosocial care, the stigma faced by survivors, and the cancer-related worries like anxiety that never seem to go away. We'll also explore practical steps you can take to find mental health support and techniques to manage your emotions independently. So whether you're personally facing these challenges or you know someone who is, stick around for a tale of understanding, empathy, and most importantly, resilience.
So my name is Lauren Burling. I am an oncology social worker. I am a licensed clinical social worker in the state of Pennsylvania and in the state of New York. I live in upstate New York, and I work for Cancer Support Community headquarters currently. Have been working in healthcare and oncology settings for the better part of the last 10 years.
How did you get into the line of work specific to oncology?
So I went to school with every intention to go into foster care for my line of work, to be a foster care social worker. And I had a mentor who in Philadelphia at Penn Medicine, he was at the Bryn Mawr School of Social Work, but he said to me, you know, I have this internship opportunity at Penn, and I just thought you would be great. And I totally trusted him and ended up working in an inpatient hospital in Philadelphia, working with people who were hospitalized going through chemotherapy for blood cancers. So that was 11 years ago, and that kind of just changed my whole trajectory from there.
That's awesome. Yeah, that's one thing I wanted to touch on before we touch on more of the personal ways that we can manage our emotions. But, and correct me if I'm wrong with the numbers, but I know, at least 40%, if not more, maybe more of like cancer survivors and patients, are either diagnosed or experience some kinds of distress. But I believe maybe 5%, a low number of them actually receive the care, mental health care. And I think part of that might be the way we approach oncology care, right? Like we really focus on that physical. Why is it that, such a small percentage of cancer survivors and patients actually receive the mental health care that they need, even though such a large percentage of us, myself included, are experiencing anxiety and stress?
Wow. This is a really good question. And I think if we look at our general population, even outside of cancer, we can see that people are typically have a lot of barriers to getting mental health care, just in the general population, that health insurance is a barrier, that access to private therapists is a barrier. Many private therapists don't take health insurance, or they have wait lists that are very full. It can be stigmatizing to walk into a behavioral health clinic for care, which is one way that people typically get access to behavioral health care. Sometimes they can't even get an appointment. They just have to walk into a clinic and hope for the best. So if our general population is having a hard time getting access to mental health care, and then you go to this very specific subgroup of people who are experiencing cancer, you just take all of the same issues that most people are having getting counseling and access to mental health services, and then you multiply it by like 100, right? Because then you have a cancer diagnosis, you have medical appointments that are 2-3 times, maybe every day while you're in active treatment. You have co-pays that are a barrier. So time is a barrier, and also just feeling well enough to get that care can be a barrier, right? Because if you don't feel well, just the motivation to make the calls you need to make to get that support can feel really overwhelming to both first general population and then thinking about our patients with or our people, that have a cancer diagnosis. So I think it's access, it's coverage, it's availability of practitioners. And then what I hear from a lot of people is that they'll meet with a therapist for the first time. They'll go in hoping for the best and really having just, the hope that it's going to be a great fit. And then they find that that person maybe just isn't comfortable talking about their diagnosis, or they just don't have the experience. And a lot of therapists and practitioners do have like general overview of ability to talk about serious illness, but there is a very small subset, I think, of people that have that really be their focus. So I'll wrap up this question because I can go on, but I find that people really are wondering, like, where are the cancer therapists? Where are the therapists out there that just do this? And that's where I think people feel a little frustrated, is that's a very, very, very specialized group of people. So then you even find that it can be hard to tap into that. So it saying all that doesn't sound very affirming or optimistic, but I know that more and more cancer centers are now embedding therapists into their cancer clinics and looking for models of behavioral health care to embed right there, because they recognize that access is a huge issue.
Yeah, and I would say, for me personally, that later point of therapists, not many being specialized in this type of care, I found that to be true very much for myself, going to my oncology office, and they do have a social worker in there, but she's more focused on different types of needs and care in oncology. So it's like I have to rely on my therapist, and while I love her, there's certain things about the cancer experience that you kind of need to be trained in. And so I do want to get back to the access question, of course, but I wanted to talk about and touch on the stigma part of your response, and just, what are the type, I can go on forever about the types of stigmas I experience as a cancer survivor, but in your professional view, what are some of the types of stigmas that cancer survivors experience, whether internally or externally, that prevent them from seeking care beyond not having access to it, possibly?
Wow. Gosh, it's so big and it's so hard. The one thing that I think about when it comes to stigma is that cancer-related depression and anxiety can feel like sometimes it's hard, first and foremost, to know what is a side effect from your illness and your treatment, and how much of it is like a separate diagnosis. So first, just kind of understanding that that some of your symptoms could be related to the disease and your treatment, and some could be truly a new diagnosis of major depression or anxiety, unrelated to your diagnosis, or of course linked. Most things are linked and connected. I find that sometimes people don't want more attention on them, right? So when you go into your cancer clinic and you're filling out the distress screens, some people don't know what that information is going to be used for. So when you're filling out these forms that measure your distress or ask you questions about your mood, I sometimes find that people kind of know maybe how to answer a certain way so that they don't kind of get too many red flags, right? So that they don't get all of those calls like, hey, we reviewed your forms and we saw that you're feeling X, Y, and Z. And it's very different to feel those things, I think, and then also to be ready to talk about them. And with all of the other things people are going through in treatment, it may not be the thing they prioritize when they're meeting with their oncologist for that 20-minute visit, once a month or quarterly. And then, of course, going into a behavioral health clinic, which a lot of our patients do need to do to get access to care. Maybe they're not able to get a private therapist appointment. They don't have health insurance coverage for it. If their primary insurance is Medicaid, they might need to walk into a behavioral health clinic and get like an intake appointment without scheduling one in advance, which I'm in the upstate New York area, which is how a lot of our behavioral health clinics work. You don't make an appointment, you just walk in. And so some of the people you might be there waiting in the waiting room with may have very different needs than you. So you're sitting there, someone experiencing cancer, someone with an immunocompromised health, you may not feel comfortable walking into a behavioral health clinic with 10 other people. So when I think about stigma, I think about that because I do think sometimes people with cancer, they say, my issues are different. This is just different than another type of mood disorder, another type of psychiatric disorder. And they may not feel like it's the right place for them to walk in.
So how can we then push past that very real barrier? What are the, I guess, things that cancer survivors and patients can do for themselves? Because it's easy to say, well, do it anyway, right? Go into the clinic anyway. Like it's so easy to say, just do it, like get over it and do it. But that's not the way, like, we destigmatize things. Like that's not the way it works. So like, what are some of the small steps that we can take as survivors to kind of push past that stigma so we can get the help we need? And I think also as people, and you can answer this in two parts, because it's two parts, but also as people in that support circle, what are some things that we can, they can do to help us, I don't want to say deal with, but like, cope with and move through and really be honest with ourselves about how we feel.
Yeah. I'll answer this in a couple of parts. So the first suggestion I have for people, other than just push through, right, is I always validate to people that this is hard. Getting a therapist to call you back is hard. Getting a psychiatrist to call you back is hard. If you can, I like to let people know that making 3 or 4 phone calls is normal to have to find somebody. Making 3 or 4 phone calls or 3 or 4 outreach attempts to find either a therapist or a psychiatrist that are accepting new patients with your insurance can be what it takes. So if a family member can help you make those phone calls, that's great. But just know that if for some reason the first person you call isn't accepting new clients, see if you can have a second or a third person in your back pocket to try as well. Space out when you're making the calls as well. If I have 10 minutes today to spend on this, that's 10 minutes of time well spent. Maybe you make that second phone call the next day or the following day. Don't be discouraged if the first person you talk to doesn't feel like the right fit for you. Again, really normal to have to maybe talk to a second or a third therapist to really feel like you found that right fit to work with. For caregivers, I would say if they can also seek their own help outside of the person experiencing cancer, it's pretty normal for caregivers to want to help find, mental health care for their loved one. And sometimes, like, just going through treatment is enough, right? So maybe they need to get through treatment and then start therapy. That doesn't mean that the caregiver can't also decide that mental health care for them in that moment is important, right? So the caregiver can also be doing the same thing for themselves. And also, I always encourage, sometimes caregivers want to come with the person to their therapy appointments or psychiatry appointments, and check in with your loved one to see if they want to do it on their own, right? Because this might be one area where they may just want that privacy, right? They may want to share really openly without having their caregiver with them. It's very different than having a caregiver attend chemotherapy or radiation with you, or a surgery consult. That might be dedicated time. But they actually may also want the caregiver there to provide some collateral on what they're seeing and what issues they're maybe concerned about. So just having that open dialogue of like, do you want me here? Do you not want me here? And definitely not assuming that they do want that person with them. That's the first point. The second point I would say is advocating and talking to the oncologist, I think, about oncologist or any physician about like, who do you recommend? Do you work with a
Mm.
therapist in the community? Do you know any psychiatrists taking patients? And even asking the question will put it on that person's radar to start to develop those resources if they don't already have those community connections. Many providers do know of people in the community. So putting that question out there, I think, is one way to remove access issues, because the more that providers know that their patients want these services, the more they're going to advocate for them in the clinics. And then they're also going to start to build that network because they're going to know that their patients want this support. So talking about it, right? Being open about your experience, if you're comfortable doing it, I think is one way to help remove access just in general.
I think that's a really
Yeah.
great point, because you're, trying to find someone, whether you're a cancer survivor or not, it is really overwhelming to make those calls, because in that moment that you're making a call or you're seeking that help, you're also having to confront the fact that you are having these feelings, right? It's never
Absolutely.
just a phone call. It's never just
Absolutely.
a internet search. It's a reminder that you're experiencing, and there's a whole stigma attached to even experiencing these emotions at all, especially if it's wrapped around survivor's guilt. And I could just go on and on and on, but
Wow.
I thought that was a really great point that you made, kind of giving that realistic view of what the process is, because it can be so overwhelming that when you don't know what is ahead of you and what you could
Mhm.
expect, it can become very discouraging to stop yourself from getting
Yeah.
help. And I think it's an incredible point that you made about caregivers finding their own help, and that how we manage other people's emotion. I know and I've, been honest about this with people and with my partner, but the first time I experienced cancer, it was a very, very hard struggle, because it was me experiencing my own emotions, and then me feeling like I had to cancer the right way so other people can feel better about themselves or what they're experiencing. And when if you go to support groups or even Instagram and see people's stories and read people's stories, it's really, there's a lot of the same theme of people around me just made me feel like I needed to just be happy and resilient and be that warrior. And it's
Yeah.
like, how
Mhm.
how do we break through that, both as
Yeah.
survivors and as caregivers? Like, how can we get past that common experience?
Mhm. Yeah. So first, just I want to validate that it can feel really hard when you have to go through your experience of cancer and then make sure everyone else is okay, right? So you're trying to be okay, and then you're also the one checking in with the people in your inner circle, and what you share with them about what you're going through is going to affect them, right? In some way. And so some people might feel like they have to filter what they share and how they share it, especially if someone in their life they know is going to really struggle with that information because they love them, right? So both processing what you're going through in real time and then also having to be the one to communicate that to other people can be really hard. I think that this is where a lot of those, um, thinking of like Caring Bridge websites come
Mhm.
into play, where people can deliver the information at once in a way that you don't have to share your story or share what you're going through multiple times, right? And so that people can receive the message, process it in their own private space, and then come back around to the person, in treatment when they're ready and when the person going through treatment is ready. Um, so that's one thing to think about, is like, how do you want your story to be shared with the people you love? You can be someone who before cancer just shared really openly, just had these really close relationships. And then perhaps cancer happens and you want to keep it private and you want to go through it alone and you want to process it on your own and then share maybe a few days out, maybe a few months out, right? So it's really important to recognize that when cancer happens, you may you may change how you decide to share with people. And when you're managing your emotions, you can't go wrong with being true to what you feel you need in that moment. And one of the core kind of things to come back to time and time again is like, I only have control over myself and my
Mhm.
emotions. and to lean into that, right? That you're responsible for yourself and the people in your life are responsible for their emotions. So when it comes to managing other people's emotions, to just remember that you're separate, that your emotions are yours and their emotions are theirs. And there's a practice sometimes I'll walk through with people, especially who have maybe some boundary issues with people who are having a very emotional response to that person's diagnosis and treatment. It's just meditation with you just picturing like this golden orb over your head, and like going through some deep breathing and picturing the orb just protecting you as it kind of goes down around your body, like a small film. So if you're someone who wants to work on kind of better navigating where your emotions end and another person's emotions begin, sometimes the mindfulness practices or meditations to picture like this is mine and that is theirs, is one practice. I forget the rest of the question, but I kind of went on a tangent there.
No, that was actually very relevant to the question that I was asking. It was really around, how do we manage our own emotions and understand that, it's not our job, like you said. And you said it more, you said it with more articulation than ever I could, but that it's not our responsibility to manage others. But touching on the practices, I would love to know, some other practices that might work for people, cancer survivors in particular, when it comes to just kind of working through their own emotions, maybe, managing them or even recognizing that they have them, right? Because there's always that point too of, well, what am I feeling inside? It's not very clear. Like, what is it? And then all of a sudden, like 3 weeks later, you might be breaking down in the middle of shopping and you don't know why, right? So it's like, what practices can we do to get in touch with our emotions and also to manage them after we recognize them?
I often think about our emotions and being able to regulate them, right? So emotional regulation is a skill that you can practice, right? So just like we practice working out or running, or driving our car or using our smartphones, there are muscles in our bodies that we can really practice flexing so that when we do end up having a moment, right, where emotions are strong or elevated, we'll have put in the work where some muscle groups are able to really support us in terms of like our response. So for some people, I often lean into mindfulness practices and awareness practices, and meditation is often the word that's used interchangeably with mindfulness, but it's a little bit different. Meditation is one way to practice mindfulness, but it's not the only way. So one practice, for example, with mindfulness that's not meditation, could be taking a walk without your phone and noticing all of the sensations of your body, of your environment, of the air, of the sounds around you, of your feet walking on the sidewalk, to really just connect with your physical body, notice your breathing, and quiet the noise for just a few minutes, right? And it doesn't have to be anything crazy like a half hour. It could be a 5-minute walk around your house, right? Especially if you're not getting out in the community or you're deconditioned, right? So it could just be a walk around your house without any devices, taking in your environment, noticing what's happening is one great way to build awareness, and to notice your emotions. When you notice an emotion coming up, here's a second practice. I moved from the walking to noticing our emotions. When you notice something coming up that you feel is a negative emotion, right? So if you're feeling afraid, you're feeling sad, you're feeling emotional, we often say, like, we label this in our brains as a negative thing. What if we started to shift our perspective to noticing our emotions without feeling the need to judge it as a negative emotion? That this is just an emotion I'm having, and it's normal for me to be having this emotion, right? We have this whole spectrum of emotions. And this is just one emotion. It's not good, it's not bad. It's not something to place a judgment on. And the same can go like when you're having a really good day. We can be like, oh, like I just, I'm really in, the flow of things today, feeling really good. That is actually also a judgment. It's a judgment towards positive feelings. So when we start to notice that we're all the time naming our judgments as good or bad, or sorry, naming our emotions as good or bad, right or wrong, we get into this idea of judging our emotions all of the time. So a practice is just very simply noticing that we do that, noticing that we name our emotions as good or bad all of the time, and letting them start to just be what they are, right? I'm having this emotion. It's not good. It's not bad. It's intense, but I'm going to just sit with it for a moment. I'm not going to make it go away, right? Because I need to feel this for a second.
Yeah.
And then also noticing that you don't always have to run away with an emotion. So one other analogy I'll give you is when you're at the airport and you have that baggage claim section where you pick up your luggage and it goes round and round and round. You're sitting there and you're waiting for your suitcase to come and you know you're going to grab it. We can think about emotions the same way in thought. So if you're having a thought that is distressing or an emotion that's distressing, you can kind of decide if you're going to pick it up off the luggage claim or not, or let it kind of keep moving, right? You can look at it from above or maybe think like, okay, that came up. I'm going to let it go for right now. I can come back around to it later if it really needs my attention, but maybe I can let this thought keep going and I don't have to indulge it at this point in the day.
That is such a good analogy. I hadn't thought about it that way, but that's amazing. And I think I'm going to have to apply that to my life for sure. But I wanted to get back to like
Yeah.
the negative, positive, and
Yeah.
the judgments on our emotions. That makes me think about dialectical thinking. So one thing I often,
Always.
talk to people about, talk to my,
Yeah.
go through myself about is that it's okay to be grateful and angry at the same time. It's
Yeah.
okay to be worried and positive about the future, if you will.
Both can
And
be
it just,
true.
yeah, both could be true at the same time because we are such, we're a multitude of emotions, right? And I find that a lot of cancer survivors, like I said, myself included, we really do struggle with that because it's like we feel as if we have to be grateful all the time because we're alive. We have to have that gratitude. And while that gratitude can serve us really well, we tend to maybe push aside those emotions that would be labeled as negative, right? How can we really let that seep in that like we are allowed to feel multiple things at once?
Yeah. Wow. So if anyone's interested in learning more about dialectics, so dialectical behavioral therapy in oncology is a niche and it is very helpful for people, I think, sometimes because it is very grounded in radically simple concepts, like exactly what you just said, right? That I can be happy and I can also be angry, right? I can be having a good day and I can also be sad about something that happened, right? That both things can be true. So I think your question was, how can people say that last word again?
How can we let it seep in, right? Because
How
like I
can we
think
let it seep in? Yeah.
part of our
Yeah, you're right.
managing.
Because it's interesting because it's one thing to say it and it's one thing to practice this. And it's another thing entirely to believe it with your
Yeah.
whole being and to really believe it. And when you're saying it out loud, you want it to be true. And so I think, like anything, the way we talk to ourselves really influences our thoughts and that influences our actions. So the more we practice certain ways of talking to ourselves and being, that does have a positive effect. So not to say that your like positive thinking is not what I am advocating for here.
Yeah.
I'm advocating for recognizing the way that we feed certain emotions and feed certain thoughts and just noticing that we can balance it in different ways by practicing new ways of thinking and talking to ourselves um, and just affirming our path and our emotions. So it might be something like today was hard. that's a that's a affirming statement, right? Today was hard. It's validating to the person, right? You don't have to do anything about that thought or that emotion, but just to recognize that today was hard, right? And what do I need to do today to improve the moment just a little bit, right? Um, Knowing that it was a hard day. I don't need to make the day better. I don't need to redo it. I don't need to hash it over with somebody, but I just need to name that it was hard. And that's okay, right? It's okay for it to just be hard. Um, Back to really quickly the idea of managing other people's emotions is I think some people might want to try to fix that for the person. And sometimes what people really need is just to be able to say, this is how I felt today, and I don't want you to fix it, and I don't want you to give me advice. I just want you to be someone that I can talk to, and you'll listen, and I can say this thing without you wanting to fix it or make it better. We can't make it better, right? There's no making it better today.
Yeah,
Yeah.
I was going to say that reminds me of the book, The Whole Brain Child, and they have a section in there about like naming it to tame it, right? That
Oh,
sometimes it's just really about being able to name the emotion
yeah,
without that judgment that you're taught,
absolutely.
like without judgment for
Yeah.
us to really like actually let it go, you
Yeah.
know?
Yeah. Yeah.
I was thinking also, what are some other beyond mindfulness? Like, what are
Yeah.
some other practices that, we can do to, help us cope with our emotions when
Mhm.
we don't have access to a therapist,
Mhm.
right? Or we may not find comfort in support groups. What
Yeah.
can we do for ourselves? What other
Mhm.
some other things we
Mhm.
can do for
Sure.
ourselves?
Um, you know, so related to mindfulness, but separate could be writing your emotions. Writing is private, it's a private space. Writing can also feel overwhelming when you're not feeling well, right? It can feel like another thing you have to do. So something really simple like writing down 1 or 2 lines a day, or writing 1 line, one affirmation. Um, Affirmations, practicing affirmations, and also creating your own affirmations can be one particular kind of mindfulness practice, but it's kind of separate. Um, if you feel well enough to take short walks or time outside or changing your environment, change your perspective, that can feel very, very therapeutic and can kind of change your emotions. Again, if you're feeling well enough to take short walks and you're able to, or able to change your environment and being outside, one small thing. Um, I really like that you differentiate, what can you do if you don't have access to a therapist, right? And I think support groups can be a good fit for some people. It may not be the right fit for all people at different points in their treatment and survivorship. Um, some people might recognize that hearing too much about other people's experiences actually is not the thing that helps them. So also recognizing that when you try on different things, when you're looking for help, that you're not wrong if something worked for another person and it didn't work for you. Like, so to really honor that, thinking about other exercises. I think that we're meaning makers as
Hmm.
a species, right? Like, so just as a species, we want to better understand why things happen, or what is the purpose of what I'm going through. Does it have a larger meaning? Sometimes for people, that means leaning into their faith if they are aligned with a faith. Sometimes meaning is not associated at all with faith, and it's more about just finding a purpose within your disease. I think that might be why you see a lot of people become involved in community organizations, right? Either during treatment or following when they're a little bit past their treatment, because they've now gone through this and they want to make a difference. They want to make an impact. Um, so they're going to help people in the future, right? So I think that's one way that people probably manage their emotions is just being there for other people and sharing their experience and taking what they went through and making some meaning out of it.
Yeah, I know that that was true for me for
Mhm.
sure, which is how I got involved in the KCA and doing what I do as a fitness coach for people with
Oh,
kidney
wow.
issues.
Yeah.
I did want to pivot though, about the parent-child relationship, because I think that is
Sure.
a
Wow.
much different, though related, beast to managing your own emotions. I think myself as a parent, I have an 8-year-old son. Um, he's going through his own, right? I was able to find him free counseling with Wonders and Worries, which is an
Wow.
excellent group here in Texas that's focused on children whose loved ones have or had cancer. And then there's also Camp Kesem actually, which is for children, same thing, whose
Wow.
parents have and had cancer, and they meet, once a year in camp, and they are able to like share their experience with other kids,
Mhm.
especially if they're in a school where they don't have that, right? But as a and that is, something that I do for him because I know that he needs it, right? But
Mhm.
as a parent, as his
Mhm.
parent, seeing what he goes through,
Yeah.
and I'm going to try not to cry about this, but it's hard for me to not blame myself for having had cancer twice, especially like having had it twice in such a short period
Wow.
as well. Um,
Wow.
how for parents specifically, how can we, I guess reconcile that feeling, work through that feeling, and maybe even, talk to our kids about it, to a
Yeah.
certain point, because granted, I'm not going to talk to an 8-year-old about me blaming myself, right? That's not,
Oh gosh. Yeah.
mentally okay for him. But,
Yeah.
how can we reconcile that and really,
Wow.
navigate that dynamic?
Yeah. Well, I definitely think kids know a lot more than we sometimes give them credit for, right? So that's what
Yes.
one of the big things whenever people are talking about, like, well, how do I share my diagnosis with my child and how do I involve them to the point that you're comfortable, involve them, right? Let them know what's happening because sometimes they'll create their own story if you don't let them in on what's happening, right? Not always, right? So there
Yeah.
are some things that, are not, you don't share everything, maybe with, your child, depending on their age. But the more you feel comfortable including them so that they know what's happening age appropriately, um, that can be very can feel safe for them to be read in on the experience so that they don't have to create their story around it. And I think it's okay to share some emotions with them as well, right? You're modeling for them what it's like to go through something that was unexpected and hard. And it might be their first experience of recognizing that hard things can happen and we can learn to cope. And you, as their parent, are really modeling for them how to cope effectively and with ease on the best of days and on the hardest of days. And sometimes that means, like, I just don't know where to go today with this. Like, um, and asking them for their input on, like, hey, mommy had a hard day yesterday. I'd really like to do something special. What ideas do you have for us to
Mm.
spend some time together today? Like, what would you like to do today? Within reason. Maybe give them
Yeah.
two choices. Because then you could be on your way to Disney World. But getting their input and helping them to let them know that they can also ask questions, right? Um, and yeah, and I think I'm talking about this in the scope of like the parent being the person going
Hmm.
through cancer. I guess my other question for you is you know um, um, the other can sometimes be true as well, right? When the
Hmm.
child is the person going through cancer, and maybe the child is um, under the age of 18, maybe they're in their early 20s, maybe they're older, right? And then their parents also involved. This is a really interesting topic that I'm not so aware in the pediatric oncology
Hmm.
realm, but definitely is worth talking about more.
For sure. And to that, I have a couple of questions.
Yeah,
Then I
yeah,
think with children, what can we do beyond modeling our own emotions?
yeah,
Like, what can we do to help them, navigate their own beyond maybe putting them into counseling
yeah.
service? They may not want to, even if,
Right,
whether they're over 18 or under, they may not
right,
want
right.
to.
That's a good point.
But what are some other things that we can impart on them, or maybe talk to them honestly about the way they can navigate their emotions and talk about it?
Mhm.
We can't force them to talk to us,
Yeah,
but what can we guide
right,
them with?
right, right. Absolutely. Well, they're going to take your lead, right? So if they know they can talk about it, that's always a really good place to start. And even if they
Hmm.
choose not to, that's okay, right?
Yeah.
Yeah, because you're right. There could be a part of this where you might think that your child wants therapy or needs therapy, but that may not be where they're at right then and there, right? Like they might want to go to their team sport and just be with their friends, right? And they may want to just kind of um, continue living their life as it was before and not, maybe making any changes or being a part of any groups. That might change, right? So kind of
Yeah.
being on standby, doing check-ins from time to time about, um, how are you feeling? Do you want to, have you thought any more about joining this group? There's these other
Yeah.
kids that also have parents that have a cancer diagnosis or had a cancer diagnosis. Is that something that interests you? And their answer might change over time, right? So recognizing that maybe if they aren't ready for something 1 month, keep checking in about it because that could change, right? Um, and they could not bring it up themselves, right? So they may not know how to bring it up themselves if something's offered to them once and then not circled back around again, right? So if you can keep checking in on them with their emotions, as well and finding out, are you still feeling like you want to be going to soccer on Monday nights, or do you want to stay home with me on Monday nights? It's my treatment day. I know that sometimes you're wondering if I'm okay after treatment. Do you want to stay home with me, or do you want to go, to your extracurricular activity? And just not assuming that it's going to be the same from week to week, but that they might really need to keep being involved in that conversation ongoing.
And I want to get back to the pediatric oncology. I know that
Yeah.
that's not necessarily your specialty, but
Mm-hmm.
as parents who have children going through cancer, what can they do to
Mm-hmm.
help their child manage what they're
Yeah.
experiencing without centering themselves, right? You want to make sure in that
Right.
situation that, especially since they're still developing, that they really,
Yeah.
can have that handle. How
Yeah.
do
Yeah.
parents help their children in
Right.
that way?
Right. Well, the good news is to my knowledge, there's usually a pretty strong network of people that get involved anytime a child has a cancer diagnosis. So you would have, a pediatric oncology social worker. Usually that person is linking up with the school
Okay.
therapist or school social worker and kind of making a connection and making a net for really to support that person, that child, and that family. So luckily, parents have those supports to really lean into. So that's really my first. That would be my first suggestion: is find out who those people are, find out who those champions are going to be for you and your family during that time at the cancer center, at the school, in the community, and you don't have to do it all as the parent, right? Like this is obviously your child, your life. I'm 4 months postpartum, so I'm just like I can't even imagine.
Yeah.
Um, but that you know, to lean into your networks to find out who your support people are. And it's hard because I imagine as the parent, you become both the parent and then the manager of your child's healthcare. And that is like a full-time job in and of itself. So to notice what can be delegated to other family members, maybe another partner in the family, other adults in the family, and just know that sometimes if you can delegate the healthcare management responsibilities so you can be the parent, I wonder if that could be helpful for everybody, right? Because there's
Yeah.
that line gets really grayed.
Yeah. Um, well, I know we have about 10
Yeah.
minutes left. So I wanted to pivot to survivorship, right?
Right.
There are, I think, during treatment, and during survivorship, there, I think, maybe differing emotions, right? There's still
Yeah.
things that cross over, but they're, one's more present and then one's kind of like worrying about the future, maybe. There's more of that, like, there's a term I want to say, that the projection of what the future may look like.
Mm,
What are some
right.
ways that we can, kind of calm those
Yeah.
voices, right? Because scan anxiety is always
Mm,
going to be a thing, right? Like we're always going to be worried about
yeah.
whether it'll come back, whether it'll be a new primary,
Yeah.
what are we going to do? Are we going to die from this? It's, I've heard people say, and I kind of believe this myself, that survivorship can be more traumatic than treatment itself, because there's so much that's
Yeah,
uncertain.
there's so
So
much
how,
unknown.
yeah, how do we, what are some ways, what are some things that we could say to ourselves beyond like the practices you gave us? What are things that we need
Right.
to remember to, work through that?
My gosh. So I think like people probably sometimes wonder, like, am I the only one who's ever felt this way? So first, knowing that it is so common to be worried about the future. When you stop going through active treatment like chemotherapy, radiation, and surgery, those are very there's a lot of movement in behind those things, right? So you're busy, you're involved, you're taking actionable steps towards managing your cancer. And when you are finished with those things, when you're going into survivorship, those actionable steps just look very different, right?
Mm-hmm.
They get spread out. So going to your quarterly appointments, taking your oral medications can feel like not as maybe actionable as what your active treatment was, but those are still actionable steps, right? They are just your management of your cancer has changed. Um, and it may just look like you have a little less contact with your oncologist, but they are there, right? They're there for you. They're waiting in the wings, and they are, so we talked about affirmations earlier. Affirmations can kind of come back in here, right? Where you might say to yourself, I'm doing everything I need to do today to manage my cancer, right? Like I've done everything I need to do. There's nothing else I need to do today except be with my family, right?
Mm-hmm.
My oncologist has my best interests at heart. My oncologist is looking out for me in every way. Because we wonder, like, what are we not doing, right? So that's really where that anxiety comes
Mm-hmm.
from, is that fear of, is there something else I should be doing that I'm not doing right now? And so to just recognize that that emotion is valid, but, or I should say, and how much we feed that, right?
Mm-hmm.
Noticing that, and noticing if you can reframe your thought from what am I not doing to I've done everything that I can do to manage this, right? I've done the work, right?
Yeah.
And now it's time, giving myself permission to be okay with those less frequent visits, right? And to see if you can get a little bit back of your life that maybe was on pause when you were in active treatment, right? I don't know how to, tell someone not to worry about the
Yeah.
future, because it's just normal, right? It's a really normal emotion, and it's a normal coping strategy for a really unusual experience that people have gone through. So, just noticing that your emotions are valid whenever you're feeling them. You don't have to push them away. Some days are going to be better than others. Um, and some people really start to lean into those support groups after treatment when they have that time. Revisit it. If it's something that wasn't a good fit for you during treatment, maybe a survivors group is a better fit, once you're
Mm-hmm.
finished with treatment. Figuring out who your people are, like who is your safe person. Sometimes it's nice to identify someone in your life who's a good friend, maybe not a best friend, maybe a good friend, maybe not your spouse, maybe not your sibling or your parent, but someone who you can ask, like, hey, can you be my person? Because sometimes it's too big for me to talk to my spouse about this, right? Sometimes I just need a really good friend, and
Yeah.
putting that person on standby in the wings. And um, that's actually one thing you can do at all parts in your life, is just kind of recognizing who you want your go-to person to be, and letting them know ahead of time, like, hey, I think of you when I think of like who my person is going to be on a hard day. Like, I just want you to know that I've literally named you, and putting you in my phone as that person.
That is such a good piece of advice. And I want, before I let you go, I want to double
Mm-hmm.
down on one thing, that what we're
Yeah,
feeling at any
yeah,
stage of our journey
yeah,
is normal. I think
yeah.
it's so easy to forget, and that what we're feeling is normal. I think it's so easy to convince ourselves that we are the only one who's feeling this way and we're not normal for it. So just doubling down on the fact that our emotions are normal and that's okay, I think is really important.
Yeah.
Before I let you go, I do want to ask, is there anything else that you may want to add that maybe I forgot to touch on or that you wanted to bring up as a point?
I think we covered so much. This was such a good conversation. So
good.
thank
I'm glad.
you.
I'm glad that you thought so.
Yeah, no, absolutely. I think just to reaffirm what you just said is that you are having a normal experience to a very difficult event. And there is no guidebook that people hand out for how to do this, right? So, you know, any way you're doing it is the right way. It's the right way for you and for your family. So you know your family best and you know yourself best.
Thank you so much. And I very much enjoyed the conversation. So I'm glad to hear that you did as well.
Yeah.
So thank you so much for coming on the show.
Thank you, Anna Maria.
We hope you enjoyed this episode of Kidney Cancer Unfiltered, brought to you by the Kidney Cancer Association. Please subscribe wherever you listen to podcasts to get episodes weekly. And if you like the show, we'd love it if you left a review. It really helps others find us. Thanks again for listening. For more information about kidney cancer, visit the Kidney Cancer Association online at kidneycancer.org.